Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is a sodium blood test. So let's get started. So before we get into the specifics of the sodium blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So a sodium blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for a sodium blood test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. This blood tube is then sent off to the laboratory where it is analyzed and resulted. So what is sodium? Sodium is one of the key electrolytes that is found in the body, essential for maintaining proper fluid balance, nerve function, and muscle function. As an electrolyte, sodium carries an electrical charge, which when dissolved in bodily fluids, such as in the blood, helps in various physiological processes. So there are actually four main key functions of sodium, and they are the regulation of the fluid balance, nerve impulse transmission, muscle contraction, and blood pressure regulation in the body. So let's explore each of them a bit further. So sodium plays a critical role in maintaining the balance of water inside and outside of cells in the body. It works well with other electrolytes such as potassium and chloride to control the distribution and movement of fluids throughout the body, particularly in the blood and the tissues. Sodium is also essential for nerve impulse transmission. So sodium is vital for the proper function of neurons, which are the nerve cells, as it helps generate and transmit electrical signals across nerves by moving in and out of cells during a process called action potential. Sodium is also important for muscle contraction. So sodium plays a role in muscle contraction by helping to initiate electrical impulses needed for muscle fibers to contract and relax. And this is very essential for all the muscles in the body, but particularly the heart muscle as well. And finally, sodium is also important for blood pressure regulation. So sodium affects the blood pressure by regulating fluid volume in the blood, and too much sodium can lead to an increase in blood volume, which can raise the blood pressure, which is a disease called hypertension. So now that we know what sodium is, let's take a closer look at what the sodium blood test is all about. So a sodium blood test measures the amount of sodium in your blood. As mentioned in the previous slide, sodium is an essential electrolyte that helps regulate water balance, muscle function, and nerve signaling in your body. This test is typically ordered by doctors to assess your body's fluid balance, electrolyte levels, and to help diagnose conditions that may cause abnormal sodium levels. So the sodium blood test is also commonly performed as part of the urea and electrolytes panel, or the UNE blood test, which includes other important tests like potassium, chloride, and blood glucose. So I have actually just recently done a video on the UNE blood test, and so I will put a link in the description box below in case you're interested in checking that video out as well. You'll probably find it quite insightful, and it will definitely help in your understanding of the sodium blood test. So moving along, what are the normal ranges of sodium in the blood? So the normal range of sodium in the blood is typically between 135 to 145 millimoles per liter of blood. So that normal range again is 135 to 145 millimoles per liter. In cases of low sodium, it's a process called hyponatremia, and this means that we have a sodium level that has dropped below 135 millimoles per liter. And in cases of high sodium, this is a process called hypernatremia, and this means that we have a blood sodium level that has fallen above 145 millimoles per liter. So now that we know what the normal ranges look like and the abnormal ranges, let's take a closer look at the causes for abnormal ranges. So first we'll discuss abnormally high sodium levels or hypernatremia. So abnormally high sodium levels in the body is known as hypernatremia and can occur when the concentration of sodium in the blood exceeds 145 milliequivalents per liter or millimoles per liter. And those degrees of measurements can actually be used interchangeably. So the causes of hypernatremia include, number 1, dehydration. So when the body loses more water than sodium, for example, through excessive sweating, diarrhea, or vomiting, such as in the cases of a gastrointestinal infection, for example, the concentration of sodium in the blood will rise, leading to hypernatremia. At number 2, we have inadequate water intake. So elderly people or those who are unable to drink fluids adequately may experience hypernatremia, especially during illness or in exposure to hot environments. At number 3, we have diabetes insipidus. So this is a condition where the kidneys are unable to conserve water, leading to excessive urination and dehydration, which can cause hypernatremia as well. At number 4, we have excessive salt intake. So consuming large amounts of sodium through the food, drinks, or through IV fluids can cause an imbalance in sodium and water levels in the body and also lead to hypernatremia. At number 5, we have medications. So certain medications like diuretics can cause the body to lose water and to concentrate blood sodium levels, causing hypernatremia. And finally, we have kidney dysfunction. So the kidneys regulate the sodium and water balance in the body, and this means that any kidney disease or damage may affect the body's ability to properly control sodium levels, and this can also lead to hypernatremia occurring. So if we take a closer look at the right side of my screen, you'll see that I just added a few symptoms that occur in hypernatremia, or this is basically how the patients present in cases of hypernatremia. So they are usually thirsty, confused, and irritable. They do experience muscle twitching or weakness. They can experience seizures or be in a comatose state, and they're usually full of fatigue and lethargy as well. So that's the typical presentation of hypernatremia. And so moving on, let's talk a little bit about abnormally low sodium levels in the body. So abnormally low sodium levels in the body is known as hyponatremia and can occur when the concentration of sodium in the blood falls below 135 milliequivalents per liter or 135 millimoles per liter. And the causes of hyponatremia include, number 1, excess water intake or overhydration. So drinking too much water can dilute the sodium levels in the blood, leading to hyponatremia showing up on a blood report. At number 2, we have heart failure. So congestive heart failure can cause fluid retention, diluting blood sodium levels, causing hyponatremia. At number 3, we have kidney disorders. So conditions like chronic kidney disease can impair the kidney's ability to regulate water and the sodium balance, leading to low levels of sodium in the blood. At number 4, we have liver cirrhosis. So in advanced liver disease, such as in cases of liver cirrhosis, the body tends to retain fluids, which can dilute the sodium in the bloodstream, leading to hyponatremia. At number 5, we have SIADH, or the syndrome of inappropriate antidiuretic hormone. So when the body produces too much antidiuretic hormone, such as in cases of SIADH, this leads to water retention and sodium dilution in the blood, which causes hyponatremia to show up on a blood report. At number 6, we have adrenal insufficiency. So conditions like Addison's disease can cause a decrease in the hormones that regulate sodium and water balances, causing low levels to show up on a blood report. At number 7, we have the use of certain medications such as diuretics or water pills that can increase the urine output and can also lead to sodium loss in this way, causing hyponatremia. And we can also have the use of some antidepressants and antipsychotics that may increase the risk of hyponatremia as well. At number 8, we have vomiting, diarrhea, or sweating. So excessive loss of fluids through vomiting, diarrhea, or heavy sweating can lead to a loss of sodium as well. And finally, at number 9, we have severe burns. So large-scale burns can cause significant fluid and electrolyte losses, also leading to hyponatremia. So again, on the right of my screen, I've just included some symptoms that can occur in hyponatremic patients. And these patients usually present with nausea and vomiting, headache, confusion or disorientation, fatigue and weakness, muscle cramps or spasms, irritability or restlessness, seizures, and even sometimes comas. So severe untreated hyponatremia can result in a coma and can be potentially life-threatening. And so the take-home message, as we have just seen, the sodium blood test is vital for diagnosing, monitoring, and managing a wide range of health conditions. By providing insight into sodium levels, it helps healthcare providers ensure the body maintains the proper electrolyte and fluid balance, avoiding potentially dangerous health complications. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with anyone you think may find this helpful. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can say thank you by buying me a coffee. So the link to buy me a coffee can be found in the description box below. Take care and have an awesome day further. Bye for now.